introduce yourself, one sentence elevator pitch on what you do, and how is your work differentiated and uniquely making an impact in behavioral health?
Hi, everyone. I'm Tina Keshani. I'm the co-founder and CEO of Starling. I'm also a new mom of a feisty and sweet 5-month-old girl. Starling is a women's behavioral health company, and we focus on offering specialized treatment for women who are going through the motherhood journey. And specifically, we focus on pregnancy, miscarriage and loss, fertility, postpartum, and early parenthood. And what makes us really unique is that we offer specialized care. All of our therapists have perinatal expertise. We offer specialized groups. We have specialized content in our app, as well as medication management. The thing that makes us really unique and differentiated overall, though, is that we partner with OBGYNs to identify women early on in their journey who are struggling with mental health and getting them into care really quickly. And we also have really broad, vast in-network coverage that makes care really accessible and affordable for women across the country. We are focused on the 1 in 5 women who are struggling with their mental health through pregnancy and postpartum, and specifically the 85% of those who are diagnosed who never receive treatment. When we think about the next 12 months, what I'm really excited about is our expansion into Medicaid. We're currently live in 10 states across the country, expanding very quickly, partnering with most commercial plans, and Medicaid is a huge gap that so many women need today when it comes to their own mental health support during this really important time.
Would love to hear, kind of given, I have a background in women's health and behavioral health, where you're seeing kind of the bulk of the need. Do you tend to see it kind of in the period before, because there's definitely a lot of anxiety associated with birthing and a lot of that, or the period after where you're sleep deprived and you've been given a baby with no support? So when do you see those peak moments of need from a behavioral health perspective for new moms?
So today, actually, most of our patients come to us at the postpartum mark, because a lot of the OBGYNs that we partner with are screening their patients at that 6-week postpartum visit. And so the way that our programs work today is that we are sort of that natural resource when an OB identifies a need in their patient during that screener. Now, where we're going is actually creating a screener of our own at Starling that integrates into a lot of these clinics, that allows our clinicians and OB partners to screen their patients way earlier in the motherhood journey, so specifically during pregnancy. And what we're finding with our initial results is that we actually can identify women who are at risk and are starting to see some of those mental health issues come up early in their pregnancy journey and are at risk for more severe symptoms postpartum. And so today, a lot of those issues are identified a bit too late. We can do so much to get ahead of those issues earlier on with better screening tools, like the one that we're launching at Starling.
Do you think AI is overhyped, underhyped, just hyped enough when it comes to, your particular category or company?
That generally for our category, I think it's probably a little overhyped. And the reason I say that is because I don't think it's going to replace direct patient care, but I see it as a really important enabler for providers, and specifically for us, how we think about clinician burnout. So I love AI. I think it's awesome, but I don't think it's going to solve all our issues, but I think it's going to definitely make the environment an easier place for clinicians to work.